Hi, my name is Mallory Miles, and we also have Amara with us today. To start off our interview, could you please introduce yourself and briefly explain your role and your job, please?
Yeah. So my name is Dr. Wafia Sarwar. I'm a primary care physician, and I am an American Family Practice Board physician, certified board physician. I work for St. Mary's in Amsterdam. It's one of the hospital in upstate New York. Maybe Albany is a New York capital, right? So this is like 40 minutes from Albany toward more underserved area. And I've been working for St. Mary's around more than 15 years, a long time ago. I'm quite ancient now. So being a family physician, I see both because I'm a general practitioner. I see both kids and adults. So starting from newborn all the way, my elderly patient, the highest in age would be 101, 101. So I see all ages. So one of the role for a primary care physician when we see patients at any age, so especially annual visits. So when we talk about it's a preventive care approach, which means that not only we talk about like screening, age appropriate screening for different diseases, different conditions, immunization for prevention of injury. So it's all preventive care. So also preventive injury. So not just for the kids, but for elderly also. I know your main concern is childhood injury prevention, but we spend equally as much amount of time in elderly also for preventing injuries, because one of the biggest cause of hospitalization in elderly also fall related disabilities and losing independence. So similar approach we do apply in elderly also. So it's something that we apply on all ages, but usually the youngest age and then the elderly, those are the more vulnerable type. So I think that would be enough for the introduction. I'll let you
Yes,
see.
perfect. Thank you so much. That is such a wide range of ages that you
Yeah,
cover, so that's
yes.
super interesting. Kind of going off the first question, you briefly talked about this, but we're focusing on injury prevention this month. So, why is injury prevention considered an important public health issue, especially for younger children and their parents and families?
I think the biggest reason is because, especially with children, it's completely preventable. And there are multiple studies shows that if you apply early and especially emphasize on education earlier for age appropriated preventions and education, some of the mortality related injuries, you can prevent them very, very significantly. So if you look at all safety, all injuries, like depending on regardless of the cause, um, multiple studies show this more than 70%, which is really important because some of these injuries result in lifelong disabilities, you know. So earlier you do, you're able to not only prevent mortality, long-term disability, um, also significant burden on the families down the road. So, and it's 100% preventable. So it's just making sure anticipatory like guidelines, using them safety early in life. Yeah.
Yeah, that's great. Thank you so much.
No.
My second question for you is based off of your experience and your knowledge, in your job. What are the most common types of injuries that you see in children? And then where do those injuries normally occur? Like in home, in sports, school?
Yeah. Usually it depends on the age, of course. So, for example, like in toddler, you see a lot of, for example, injuries like suffocation, ingestion of which can be preventable, falls, especially in younger kids, toddlers fall, which are usually at home, and fire-related injuries, of course, at home. But as the children grow, for example, like head injury, concussions, for example, as early as, for example, 5, 6, 7-year-old starting bicycling, which can be prevented with proper use of a helmet and safety measures. So you start seeing that around age 5, 6, as you see kids, and also drowning injuries early in life. And as the children grow, especially sport related injury, once they are, for example, as soon as you start seeing kids in varsity, different types of sports, if you go to any ER around the time when the school starts, within a few weeks later in September time, depending on the what game, especially soccer, like for example football, as soon as the season starts, a couple of weeks later, if you go in ER, you will see multiple kids with fractures. So it's like age appropriate. So you sports injury, of course, at school, motor vehicle type of a accident, regardless of the ages, you see that all along. So so when what did we went over? Drowning, chemical ingestion, suffocations, falls, bicycle related, um, and also, of course, in school you see injuries or concerns or consequences from bullying, those type of concerns. Of course, later in life, most of these, of course, are preventable, and with proper education, especially both at school and at home, you can help avoiding them. Those are the top few that I can think of. And of course, inside the house, for example, fire related by those are also preventable by installing fire detectors, gun related injuries at home for if if not educated appropriately, parents, so those are at all costs. I think those are the top 6 or 7 that I can think of.
Yeah, no, that's great. Thank you so much. And then again, you kind of just touched on this with like the gun issues and then the fire related with like fire alarms, but what simple steps can parents take at home to reduce the risk of accidental injuries?
Which injury you said?
Accidental, so just like
Oh,
any,
accidental
yeah.
injuries, yeah. So especially at younger age, usually it's like when I mentioned toddler, which can be prevented at home with education. It's in a kitchen related, for example, like um, having cabinet in child-proof locks, for example, 100% preventable. And for example, utensils being appropriately placed, like knives related, sharp utensils related injuries, um, and also, for example, stove-related burn injuries. So those are all can be prevented by installing, like for example, child-proof locks, gates, and then gates at the, for example, stairs, those type of things. Fire detector, we discussed that earlier. So for drowning, making sure having the fence pool should be always locked, and then younger kids, especially around kitchen areas, fire related or water related, regardless of at home or outside. So has should be supervised all the time, not even like 100% continuous supervision, especially around those water and fire related, for example, 100% continuous supervision. Usually most injury happens in a millisecond, like a second you leave and something would happen. And also sometimes the expectation of a parent saying thinking that an elderly sibling may be able to supervise a younger sibling, and usually that's the time when you start seeing, for example, see injury happens within short period of time. So expecting more from a child what they can perform, and also thinking the child will make a appropriate decision at the time and they will not do something and it happens. So continuous supervision on those around those 2 areas.
Yes, thank you so much. I totally agree. So talking about what parents can do, my next question is how can schools and community organizations help create safer environments for children?
Yeah. So, for example, like when we discuss motor vehicle, especially around the school, having a crosswalks, having someone always supervising kids crossing the roads. So schools, I mean, many times we think that these things are already being done. It's how often do we always have like a checklist for every school, every community they're actually following it? So do we
Mhm.
always have someone at end of the school, someone supervising the kids crossing the roads and all that? And a lot of these are sports injury also at school. So meaning making sure that around the playground areas or right after any injury, how do we take measures? So especially concussion related head injuries, how are we approaching that to prevent a second injury? Usually after first injury, it's very, very common to see the second one when we don't take proper precautions. So post concussion, how do we address those type of kids to make sure they're ready before they go back playing the sports? So are we taking the proper measures or not? Are we making sure they are safe to return back to the sports? And also especially having counseling in when I mentioned bullying or cyberbullying earlier. So having school, um, especially having both parents and kids educated in school, showing what are the different ways that the kids can get help at school earlier without any hesitation. So having appropriate education at school and counseling to help with kids be able to freely come in whenever they need any help. And also especially any home related, for example, abuse, childhood abuse, anything like that, how to make sure we can detect that earlier and being able to provide help in school. So those are a few that I can think of.
Yes, thank you. Next is, again, you also touched on this very briefly earlier. What role does supervision play in preventing injuries, and what are the most common supervision mistakes that caregivers should avoid?
So the mistake would be expecting more from a child, thinking that, for example, like I said, they are more mature for that they will not do certain things, and especially when we say those causes, which should be supervised 100% without any distractions, regardless of how mature the kids are. So, for example, in those cases, it should always be there. And mostly it's a distraction that results in injury also. For example, distraction because of being on another device, doesn't matter, for example, either, for example, being on the computer, being on the telephone, being on a for example, working remotely and then also taking care of a child, so those type of situations. So when we have undivided for example, attention, that definitely helps. So as soon as we get distracted, so those injuries happens right away. So those mistakes can kind of when we are avoiding that, providing 100%, not in all cases, but certain, like I said, mentioned earlier, kitchen related or fire, especially kitchen related fire injuries, those type of cases, or for example, outside or even next to the house, for example, pool related areas, that should be like zero tolerance, always should be there. um, can you repeat the question? Did I miss something?
No, I think you're great.
You said
It
at
was
home.
what?
This was home related injuries you were trying to say, right?
Oh, yeah, just any advice that you would have to.
And also, especially, we didn't touch the biggest mortality one would be the motor vehicle accidents. That would be the biggest cause. So, especially making sure the child is using safety measures, including seat belts, but also appropriate car seats, or making sure that they're always using seat belts, appropriate seat meaning wearing, so especially younger kids using car seat rear view up until age 2 or as long as possible, based on the weight, and especially as they grow, it's not without any question, until any kid less than age 13 should be sitting in the rear seat, regardless of the weight, because sometimes some kids look older than their age, you know. So following those couple of things, it helps prevent all cause of motor vehicle accident related preventable injuries.
Yes, for sure. That is very important. So thank you for touching on that. My next question is, how can public health campaigns and media platforms, such as Public Health for Kids, raise awareness about injury prevention?
So when I said earlier that education, especially appropriate education, help all prevent all cause injuries, some lessons, like for example, even up to 70%, that is not just a physician role, especially new parents, and then not aware of what to expect for certain ages. When you have both education being provided at primary care level, at school level, at, for example, community level, and public programs being available for these type of preventions, it helps to kind of emphasize it even significantly more, to be able to follow these type of precautions. And also, you know, when we are doing any, for example, kids when they start driving, you go through different types of driving classes, you know, and then you go through different types of um, concerns when the precautions are not being taken. For example, drinking and driving, or distraction and driving, and then consequences. And then the idea is that understanding how severe injury can be if you're not following that. So, and the idea behind that is preventing it. So, especially with the education, we have seen that the cause of mortality based on motor vehicle, it has gone significantly down by having the laws in place and also the education. So when you combine those two things at community level, having the laws, which includes, like, for example, safety a belt, following speed limits, those type of laws, and also education, then two together with awareness, it works significantly.
Yes, that is super great. Thank you so much. My final question for you today is if you could give families some advice or key takeaways of injury prevention tips to remember every day, what would they be?
That would be based on education, being able to address that at two different levels. So especially, for example, if it's a younger child, they're not in school anymore at that time, making sure all kids, they do get some type of education, parents do get education material for age related injuries and preventions uh, at their appointments, which we should take very, very seriously in following those. But as they are growing older, and then school related, sport related injuries, for example, how do we prevent that? That education is provided by the schools, not just the primary care offices. And using them, making sure it's not just something. So many times we take that all that education material and we put it away. So going through that and making sure we're following that, it helps significantly. It's not that one in kids, in adults you can say, okay, one measures will help for all, but in kids it depends on the age related, their milestones, and then the prevention accordingly. So for example, like I said, falls and those type of injuries, it doesn't apply on all kids. But for example, motor vehicle accident related injury, because the mortality is the highest, suffocation or chemical related, those type of mortality rates are higher. So that weighs more than other causes because of the amount of damage, you know.
Mhm.
So if anything is, the most important would be the motor vehicle related injuries, because regardless of age, it applies on everybody. But the not as much of a mortality, but of course small injuries otherwise, which are not as common, that depends on age related, milestone related risks.
Yes, thank you so much. Those are all very, very important for everyone to remember. Um, do you have anything else that you'd want to add or anything you want to talk about?
uh, I think I don't want to need to add something, but I think it's very important how, for example, when you're bringing this up, depending on what type of prevention we are discussing, it's nice to be able to put any education in a perspective that is more appealing. Like I said earlier, many times when we give education material in a form like a paper form, to go through that, because if it's discussed in a few minutes, usually how much a person can remember after a few minutes, not a lot, you know.
Yeah.
And how many people go through reading what instructions have been given to them, how often people read the material, based on, I mean, looking at that and how much you are giving, for example, verbally, through media, through any seminar. Usually I think the benefit is more because of the emphasis on just one thing, and also being able to display that. It shows that the chances that someone will be following that will be more compared to someone who's going to open up the material and read through it, you know.
Yes, definitely. We'll definitely take that advice with us as we go and create curriculum for younger students about injury prevention. So thank you so much for your time and clearing out your schedule for us. We really
You're
appreciate
most
it.
welcome. You're most welcome. Have a good day.
Thank you, you too.
All right, take care.